Hello and welcome to my channel. Today in this video I will be discussing about some of the important points of practice of medicines which you should remember if you are preparing for AIA PGET 2023. So basically in this video I will be discussing about some of the important signs, syndromes and some triads of all the systems of practice of medicine. So let's start. So first we have Bipples spot. So as we all know that Bipples spots are white patches of keratinized epithelium and they appear on the sclera if you have vitamin A deficiency. So, Bipples spots are seen in vitamin A deficiency. Next point we have Roth spots. So, Roth spots are seen in subacute bacterial endocarditis, that is SABE. You can remember this term by SABE, subacute bacterial endocarditis. So, Roth spots are seen in this disease. The next point is Koplik spots. So in what disease Koplik spots are seen? Firstly, we will talk about what are Koplik spots. So Koplik spots are 1 to 2 mm white or bluish lesions with an erythematous halo on the buccal mucosa opposite to the first and the second upper molars and are pathognomic for measles. So Koplik spots are seen in measles. And they are generally seen during the first 2 days of the symptoms. Alright. So Koplik spot are seen in measles during first 2 days of the symptoms. Now next. So Pigeon Chest is found in rickets or severe asthma in childhood. Okay, so Pigeon Chest is found in rickets and severe asthma in the childhood. And now next we have virtuous node. Firstly we will talk about what are virtuous node, then I will be telling you in which disease or the case they are found. So virtuous node are these are the left supraclavicular lymph nodes. These are left supraclavicular lymph nodes and are enlarged in case of carcinoma of the stomach. So virtuous nodes are found in carcinoma of the stomach. Now next we have a very important sign that. So we will be talking about the trausius sign. So when the left supraclavicular lymph nodes are enlarged in case of carcinoma of the stomach, carcinoma of the breast or the carcinoma of the testes, this is called as trausius. Next we have a very important sign that is flag sign. So flag sign is seen in kwashiorkor. Okay, flag sign is seen in kwashiorkor. Now next we also have another important sign that is Romberg's sign. Very important sign. So this sign is mainly seen in sensory ataxic gait. Okay, so Romberg sign is seen in sensory ataxic gait. Now what is sensory ataxic gait? So in this, the patient is asked to stand with his feet close together and to shut the eyes. So there is a tendency to fall down is noted, which is called as sensory ataxic gait, and this is called as Romberg sign. I hope this is clear to you. After Romberg sign we have another sign that is Romena's sign. So this sign is mainly seen in Chagas disease or sign, and it is seen in Chagas disease or trypanosomiasis. Okay. Now next we have a Howell jolly bodies. So Howell jolly bodies are seen in, or you can say they are present in red cells. That is inclusion bodies such as parasites, nuclear residue of the asplenic individuals and pathological conditions. So Howell jolly bodies are seen in red cells. Okay. Now next we have another body, that is hinge bodies. So hinge bodies are mainly seen in the spleen, where there is denaturated hemoglobin. Okay. So hinge bodies are seen in spleen. Next we have Vance-Jones protein. So Vance-Jones protein is seen in 3 conditions or 3 diseases. First we have multiple myeloma. Secondly, leukemia. Third we have skeleton carcinomatosis. Okay, Vance-Jones protein is seen in leukemia, multiple myeloma, skeletal carcinomatosis. Clear? Now next we have Kaiser-Fischer ring. So Kaiser-Fischer rings are seen in Wilson disease, and its deficiency in Wilson disease causing disposition of copper around the cornea and give rise to Kaiser-Fischer rings. Alright, I hope this is clear to you. Now we have a very important 2 signs, and they are always asked. So first is Kernicks sign and second is Brudzinski sign. First of all, we'll talk about the Kernicks sign. What is Kernicks sign? So as we all know that this is seen in meningitis, and Brudzinski sign is also seen in meningitis. These are the 2 classical signs of meningeal irritations, or you can say meningitis. So in Kernicks sign is elicted with the patient in the supine position, the thighs flexed on the abdomen with the knees flexed. Attempt to passively extend the knee, elect pain when meningeal irritation is present. So this is Kernicks sign. Now what is Brudzinski sign? As we all know that this is seen in meningeal irritation, or you can say meningitis. So the sign is elicted in the patient in the supine position and is positive when passive flexion of the neck result in spontaneous flexion of the hip and the knees. This is called Brudzinski sign. I hope these 2 signs are very much clear to you. They are very important. The next important sign is Korsakoff's psychosis. This is a very important sign, and this is seen in thiamine deficiency, that is vitamin B1, which is characterized by memory defect with confabulation. Next we have honeycomb lung. So honeycomb lung is seen in asbestosis. One is a honeycomb lung and one is a honeycomb liver. Okay, so honeycomb lung is seen in asbestosis and honeycomb liver is seen in actinomycosis, which is a chronic granulomatous infection, and it is characterized by development of the indurated swelling mainly in the connective tissues. Okay, and there is a discharge of the sulfur granules, and sometimes the infection spread to the liver by the portal vein and producing honeycomb liver. So make it very clear, honeycomb lung is seen in asbestosis and honeycomb liver is seen in actinomycosis. Now next question we have Curly's B line. So Curly's B lines, these lines are the linear opacities which are seen in lung filled due to the interlobular lymphatics seen with fluids and tumors or the dust. Next, very important, we have Huntington chorea. Huntington chorea. What is Huntington's chorea? Let's discuss about this. So this is the autosomal dominant condition and it is characterized by first chorea, then irritability, then dementia, then leads to seizure and finally leads to death. I will repeat it again. Huntington's chorea is an autosomal dominant condition which is characterized by first chorea, then it leads to irritability, then further it leads to dementia, after that it leads to seizures and finally death of the person. Okay, this is very important. Next we have pulsus alterance. Very important. Pulsus alterance, this is seen in left ventricular functions. And it indicates severe impairment of the left ventricular functions. There is a regular alterations of the pressure, pulse amplitude, and despite a regular rhythm. Next is the electrical alterance. Next we have pulsus paradoxus. Very important question. This is seen in three conditions, or you can say in three diseases. Firstly, we have pericardial tamponade. Everybody knows it. Secondly, in airway obstruction. Thirdly, in superior vena cava obstruction. Again, I am repeating this. Pulsus paradoxus is seen in pericardial tamponade, airway obstruction, superior vena cava obstruction, and it is also seen in asthma. Next we have very important Rhys pulse. This Rhys pulse is again seen in two conditions. One is aortic regurgitation, second is hypertrophic cardiomyopathy. Okay, so Rhys pulse is seen in two conditions: aortic regurgitation, hypertrophic cardiomyopathies. Next we have a dichrotic pulse. So dichrotic pulse is seen in dilated cardiomyopathy, isn't it? It is found in dilated cardiomyopathy. Now we have a very important sign, so that is Kussmaul's sign. This is a very important sign. You should remember this sign. Okay. Now this sign, that is Kussmaul's sign, is seen in first severe right-sided heart failure, secondly in constrictive pericarditis, thirdly in right ventricular infarctions. Again I am repeating this. Kussmaul's sign is seen in severe right-sided heart failure, constrictive pericarditis and right ventricular infarction. Next we have another sign, that is Balance sign. So Balance sign is seen in splenic ruptures. Another sign is that Kernicks sign. This is also seen in splenic ruptures. So we have two signs which are seen in splenic rupture. They are Balance's sign and Kernicks sign. Kernicks sign is very important. Next we have a Bipples sign. Let's talk about it. So in fracture of the posterior fossa behind the foramen magnum, a patch of ecchymosis appear within 3 to 4 days near the tip of the mastoid process. This is called Bipples sign. Next we have Klein sign. Klein sign is seen in Meckel's diverticulum. Secondly, in acute non-specific mesenteric lymphadenitis. Again I am repeating, Klein sign is seen in Meckel's diverticulum and acute non-specific mesenteric lymphadenitis. Next we have a syndrome, that is shrinking lung syndrome. Shrinking lung syndrome is a feature of SLE, that is systemic lupus erythematosus. Okay, this shrinking lung syndrome is seen in SLE. Now next very important sign, that is it itself also a triad, that what is seen in Cardinal Syndrome. So in Cardinal Syndrome, we see bronchiectasis, sinusitis and situs inversus. Very important. Remember this sign, Cardinal Syndrome. In this sign, we see three symptoms: situs inversus, bronchiectasis and sinusitis. Next, and kwashiorkor is characterized by fatty liver, edema and Bitot spot. Next is the Crohn's disease. Crohn's disease is characterized by lymphoid hyperplasia, skin lesions, transmural involvement, cobblestone appearance. This is very important here, cobblestone appearance. And next is the string sign. Next we have a very important syndrome, that is Potter's syndrome. So Potter's syndrome is characterized by hypoplasia or cystic disease, pulmonary hypoplasia and external ear deformity. Again, I'm repeating this, Potter's syndrome. Potter's syndrome is characterized by hyperplasia or cystic disease, pulmonary hypoplasia, external ear deformity. I hope this is clear to you. Next, we have another important syndrome, that is Rhys Syndrome. The syndrome is characterized by hypoglycemia, fatty vacuolization of the liver, encephalitis, absence of the jaundice. Okay, so this is Rhys syndrome. Next, very important, Lewy bodies. So I think everybody knows this, that Lewy's bodies are found in Parkinsonisms. One is Lewy bodies, second is asbestos bodies, or you can say ferruginous bodies. So ferruginous bodies or asbestos bodies are seen in asbestosis and Lewy bodies are seen in Parkinsonisms. Now next we have sarcoidosis. So sarcoidosis is characterized by the following features. First is potato nodes. This is very important. Potato nodes, asteroid bodies and Schauman's bodies. Very important. Again, I'm repeating. Sarcoidosis is characterized by Schauman's bodies, potato nodes especially, and asteroids bodies. Next, we have Reed-Sternberg cells. So Reed-Sternberg cells, first, everybody knows this. These are found in Hodgkin's lymphoma. But we have another two conditions, that is in mycosis, fungoids and infective mononucleosis. So Reed-Sternberg cells are found in Hodgkin's lymphoma, mycosis, fungoids and infective mononucleosis. Next is serum ferritin. So serum ferritin is increased in leukemia, chronic renal failure and rheumatoid arthritis. Very important. This is very important, that what are the conditions in which serum ferritin is increased? So it is increased in leukemia, chronic renal failure and rheumatoid arthritis. Now another question we have, Bruch's tumor. So Bruch's tumors are found in hair follicles. We'll talk about asthma. So sputum of the asthmatic patient may contain first, very important, Charcot-Leyden crystals. Remember this is very important. Charcot-Leyden crystals, Cushman spirals, numerous eosinophils, Crayolas bodies and Linnec pearls. Again, I'm repeating, in asthmatic patients' sputum, they may contain Charcot-Leyden crystals, Cushman spirals, numerous eosinophilic cells and Crayola bodies and Linnec pearls. Next is hypocalcemia. So hypocalcemia is seen in acute pancreatitis, chronic renal failure. Next we will talk about HCG. So HCG is increased in yolk sac, choriocarcinoma and teratocarcinoma. Next we will see malaria. So malaria affect the following organs, like they are brain, liver and spleen. This is very important. What are the organs which are affected by malaria? So they are brain, liver and some of the important triads of practice of medicine. So first we have a triad of Aiapget syndrome. Remember, all these triads are very important, so try to remember this anyhow. So first we will talk about the triad of Aiapget syndrome. So it include sensory neural deafness, second progressive renal failure, thirdly ocular anomalies. So this is a triad of Aiapget syndrome. Second, we have a triad, that is triad of Aiapget syndrome. So triad of Aiapget, so let's talk about this triad. So there is recurrent oral ulcers, genital ulcers and iridocyclitis. Next we have another triad, that is Charcot Triad. I think everybody is familiar with this Charcot Triad. I think I have already discussed this. So what are the triads? That is pain, fever and jaundice. Okay. Next we have a Hutchinsons Triad. So in Hutchinsons Triad, what we will see, that is Hutchinson's teeth, nerve deafness and interstitial keratitis. Next we have a triad of Kwashiorkor. So there is growth retardation, mental changes and edema. Next triad is Burchos Triad. This is very important. So in Burchos Triad, what we will see, first is stasis, then hypercoagulability and then is vessel injury. Next triad is Bipples Triad. So what we will see in Bipples Triad, first we will see hypoglycemia during attacks, the next lytic body lesions, then Bipples Triad. Now next triad we have hemolytic uremic syndrome triad. So what we will see in this, anemia, renal failure and thrombocytopenia. So this is hemolytic uremic syndrome. Next we have a tetany triad, very important. So what we will see in this, firstly we will see striders, then carpopedal spasms, then next convulsions. Okay. Next we have a Pentology of the Fallot. So Fallot tetralogy with, in addition, a patent foramen ovale or atrial septal defect. This is called Pentology of the Fallot. The last triad I have already discussed is, that is Cardinal Syndrome triad. So it include situs inversus, recurrent sinusitis and triad of bronchiectasis. So this was Cardinal Syndrome triad. So I hope all these signs, syndromes and triads are clear to you, and try to remember this. They are very important for AIAPGET 2023 for all the pathies. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and yes, thanks for watching this video.